Happy to be joined with Shoneen Alexander Ross, the Acting Secretary of Health here at Mvskoke Creek Nation. So glad to have you in studio.
Thanks for having me, Jason.
You bet. Just talk about the current status of the health administration. How do you feel now that we've sort of hit this problem head on? We've started to take the steps. We've brought someone in to look and help. How do you feel about the current status?
I think we're headed in a forward direction. I think it's a great time to be at the Department of Health. We certainly appreciate having our partnership with the Southwest Hospital Partners, Mr. Roger Jenkins. Through the executive branch, I think we've got a lot of support from Chief Floyd and Second Chief. So I think it's a good time to be at the Department of Health. We're making lots of change, but it's change for the better.
If, you look at what's happened and you see, you bring in Mr. Jenkins and he's looking at everything, not only, like he said, the leadership and the turnover and some of that, but not only that, but what's happened with the finances and some leaks, as you said, some things to kind of plug up. Was there like a large deficit when we looked at what we had, when it came out that there was this large deficit, but there were other people maybe saying, oh, it really isn't that much of a deficit. Was it as bad as it seemed or as it was portrayed?
I think there was a lot of misinformation, maybe through the rumor mill and just being misrepresented. Of course, there obviously is some improvement that we need to make, and some of that is still being discovered and discussed. But in terms of the finances, I think the information that was put out at the March extraordinary session was on point in terms of figures that was delivered from Chief Floyd.
Yeah. And now we've, as you said, and as Mr. Jenkins has said, it's sort of figuring out what's going on and now moving forward. Right. So what kind of plans are you putting in place, or have you discussed to sort of take what he's found and put it into action?
I've had the pleasure of working almost elbow to elbow or shoulder to shoulder, if you will, with Mr. Jenkins throughout this process, and we're literally turning over every rock, looking in every crevice that we can, trying to find all the opportunity to make the right change, and I think we've been certainly aggressive at doing that. In terms of what our direction is moving forward, we're trying to figure out how we can always balance revenue with expenses. Right now we're going through the budget cycle, making plans for FY17 and things that we can do in order to put the health system in a really good position financially, put it in a sustainable position financially, and we're making changes to do that.
Now, anytime we have a situation like this, obviously it is good to take the steps forward and making sure it doesn't happen again, or just fixing the deficiencies. But there have been some tough decisions you all have had to make too. Can you talk about just what went into a lot of people either reassigned, relocated, maybe even losing a position, how tough that was for you all?
Historically, if you look back over the last couple of years, we've really grown really fast. Mm-hmm. What we've tried to do over the course of the last 90 days or 120 days is go in and look at where our needs truly are, where we may have overstaffing or even understaffing, because there's a mixture of both, and trying to put those resources where they best suit the Department of Health. That has led to some change, but I think it's change, again, as I said before, that will put us in a better position for the future. As with any organization, you have to maximize the use of your resources, and I think we're trying to work smarter, not harder, and be be a better steward of our resources. And we've looked at that at all levels, not only from service lines and evaluating, are we able to provide the access that we need to our patients? How well are we doing? Can we improve? But also looking at what we don't have in terms of service and what potentially we could bring in the future.
So a lot of the prior years, there's been a lot of excitement about health, which was what was such a quick turn, because you had facilities opening, like we said, acquisitions. There was event after event, and it was looking good. But then you get to the point where now, people worried about, because of these problems, you may have to close facilities. Has there been any talk about that, of closing facilities, anything?
I think we're always looking at, again, I'll go back to a statement I just previously made. Can we balance the revenue with the expenses? We're certainly not out to close any facilities per se, but we are looking at where we can strengthen those. And you know, it's just like in any industry, you have to be able to operate in the black. And that's something that we've had to dedicate a lot of time and look at how we're able to do that. In some areas, obviously, you know, we've had deficits or shortfalls. We looked at what do we need to do to recover from that. You know, revenue failure is something that many organizations experience, and in healthcare, it happens. It's happening all across Oklahoma. If you look around, you see, you know, out west, there's hospitals that's closed. You know, even in areas that are in our jurisdiction, we've had hospitals close. It's a tough industry to be in, but I think our objective is to try to position the Department of Health and all of our facilities in the best way that we can, and to help maximize the services we have and do so in a cost-effective manner.
At the most recent Health, Education, Welfare Committee, you had quite a bit on the agenda, but among those items were a few budget mods for personnel issues. Is that a reflection of sort of having to do still having to plug some holes and fix some things with the finances?
We actually did have to modify the Physical Rehab Center's budget, and I would just, you know, say across the board, just like in every industry, it's really important that staff understand the budgeting process. Mm-hmm. And something that we've discovered within the Department of Health is we've not always been strong at matching revenue to expenses. If you look at our reports that we receive every month in terms of our budget, it talks about where we are in terms of what's been budgeted for the program, but it doesn't necessarily show what we've been able to collect in revenue. So that's one change we're trying to make. As a manager, you need tools that show you exactly where you are. They need to be well understood so that you can make the appropriate decisions. And I think in FY17 you'll see that we've engaged the staff at the local level, trying to get them involved in the budget and have some ownership of that budget. At the end of the day, they're making decisions right then and there in the facility that affect those line items, and we want to make sure they're armed with the best information, and that's something we'll continue to work on.
We also look at reaction to something like this, and by all means, we're going to have citizens that are upset, some that are wanting to wait for things to come out, some that are wanting to hear from those that know the status. But what would you say for those that want accountability for where it went wrong, as to say who's going to be held responsible, or just who's going to stand up and talk about the realness of this situation?
Well, what I would say, I can tell you what we're doing now. We're trying to make some changes internally across the system. We're also addressing the composition of the governing board. We've worked very closely with Chief Floyd in the executive branch, as well as received input from the National Council on how we can modify the makeup of that board. The way it's been designed, I guess historically and almost to even present day, because we're still making these changes, we've largely governed ourselves, and that's not necessarily what the board was designed to do. So we're looking at how we can bring in maybe an advisory committee or some other members that would be external to the Department of Health, so that we can have input from the citizens and other community members about maybe the strategic direction of the Department of Health. Largely, that's what the governing board should be doing, is setting the strategic direction for the future of the Department of Health. So making changes like that, I think, makes big strides in accountability. Checks and balances should be in place. They're always a good thing. I mean, the left hand needs to know what the right hand is doing, and we're trying to make those changes in order for that to happen.
So having to do with the tough decisions, if you could, maybe a rough estimate on a number of people that were directly affected, and also your strategy now going forward to where these people will have the resources, job fairs, things like that, placement, what you are doing along with the nation to make sure that they're taken care of.
We've actually, between the Department of Health and Tribal IT, HR, and Finance, we've had a merger. Mm-hmm. We've done that to not only consolidate for cost savings, but to create more efficiency and to bring those areas in the Department of Health back underneath the executive branch. Chief Lloyd is very committed to getting anyone that's been displaced from the health side into a position. And I think, and Jason, I'm just going to roughly speak off the top of my head, I think of the 20 staff members from that HR, IT, and finance merger, 8 of those have already been repositioned back into the tribe, and we're continuously working on that. It's just been a few weeks, so just today in my office I had a letter of recommendation come across, or finished a letter of recommendation for one of the staff members. So we're working diligently trying to help staff members get repositioned somewhere in the tribe, and if they choose to go external to the tribe, we're supporting them as well.
In the process of restructuring, a lot of citizens would probably have a concern about any change in services. Do you expect or expect any change in services?
With the integration of IT, HR, and finance, I can't foresee that there are going to be any changes that impact patient care. That's one of the things I think has been really discussed very thoroughly with both IT, HR, well, and including finance, that patient care is our priority. IT, I know, is on board. They understand how important the electronic health record is to our providers and how it can impact care. So I know that's one of their main focal points. So at this time, I can't see that any of the services will be impacted.
Great. Well, Shoneen, is there anything else that you'd like to add that we haven't covered here?
I would just say that the Department of Health, while we're going through some changes, I think, as Mr. Jenkins said, we're in a really good position to have a system that meets the needs of our patients in the future. And while some of this change has been uncomfortable, I think it's going to leave us in a better position in the future.
Wonderful. Well, Shoneen Alexander Ross, the Acting Secretary of the Department of Health here at Mvskoke Creek Nation, thank you so much for sitting with us today and answering some questions, and we really appreciate you being here.
Thank you, Jason.